So I went in and introduced myself and began gathering information. The information was pretty simple to gather. First of all, I clarified that this patient couldn't open beyond one finger breadth and had been that way for roughly about 6 months. She had come to our office, not on referral from another doctor, but out of Google, and found out that, Googled doctors who help people who can't open their mouth, I guess, and came into our office. And chief complaint was, I can't chew and I can't open very well. And went into the medical history and right off the bat learned that this patient had had surgery 3 years prior for an oral cancer here in Nashville at Vanderbilt. I actually got the name of the surgeon. I know the surgeon personally. And patient had had a radical neck done along with her oral cancer surgery. I didn't have the operative note or the discharge summary or anything available to me, but I gathered from the patient and the husband who was at the room the general information that I needed about this. Examination of the x-ray showed evidence of temporomandibular joint damage. She had significant degenerative joint changes within the temporomandibular joint. Her joints were hot. They were painful when pressed on, which is certainly an indication that there was chronic inflammation within the joint. The x-ray was positive for long-term chronic inflammation. And her two symptoms that she presented with are certainly symptoms associated with temporomandibular joint disease. However, she did have a history of cancer, but on further investigation, claimed that after her cancer surgery, she was able to open fully. And by her history, the decrease in ability to open did not happen gradually, but it was all of a sudden, which again would be another indicator that it would be a disc problem. A sudden decrease in ability to open is certainly evidence of a dislocated disc. So there's a lot of information here leading to a temporomandibular joint issue, a temporomandibular joint problem. But on further delving into the history, even though the patient told me her inability to open came all of a sudden and only a short time, less than a month or three, actually, I think she said 3 weeks prior, she was able to open fully.